Calling the 1 p.m. joint hearing for Health, Human Services and Committee on Higher Education. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committees will reconvene to discuss any outstanding business on Friday, the 21st of March, 1 p.m. in room 225. For those on Zoom, your audio will be muted and video disabled until shortly before it is your turn to testify. Each testifier will have 1 minute to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony. I reviewed them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. First up, we have, for HHS-HRE relating to cigarette taxes. First up, we have Department of Taxation providing comments.
Aloha, good afternoon, chairs, vice chairs, members of the committees. Winston Wong, Administrative Rules Officer on behalf of the Department of Taxation. The department stands on its written testimony providing comments on this measure, just highlighting that the only request that we have in the event that this bill is passed is that it take effect by January 1st, 2026, if the rates are changed in order to allow for us to order and issue new stamps. That's all. I'll be available for questions if you have any.
Okay, thank you very much. Next, we have Department of Health in support.
Good afternoon, I'm Lola Irvin, representing the Department of Health. Thank you for the opportunity to provide testimony, Chair and Vice Chairs. So cigarettes are not a part of creating a healthy futures for our children and families. And increasing the cigarette prices work to deter young people and youth from starting cigarettes. We know that 80% of people who start get addicted. No one is ever grateful that they started using cigarettes. Cigarettes are still the leading cause of preventable disease and death. So we support HB 441, and we do request that the price increase go up to 21 cents. It has not increased since 2011. Right now, it's 16 cents a stick. So we are requesting a 5-cent increase. Thank you for the opportunity to provide testimony.
Thank you very much. Next, we have Deputy Attorney General in support. Richard Stacy, are you present?
I am.
Okay, please proceed.
Good afternoon. Rich Stacy, Deputy AG with Tobacco Enforcement. We do support HB 441. We do realize that the Cancer Center is plays a very important role. And as Lola Irvin mentioned, the taxes haven't been raised since 2011. Clearly, health costs have not gone down over that time period. So we do support this effort. Also, for our own unit, we are underfunded at the moment. We did get some funding that's coming in soon from last year's bill. Thank you very much. But this would also help support tobacco enforcement. We do always risk arbitration in tobacco and with the big tobacco companies. We've been negotiating for another settlement. That hasn't happened. We got $36 million last year in MSA money. We're expecting a similar amount this year. We need the money to keep funded, available for comments. Thank you.
Okay, thank you very much. And I apologize to senators present with me are my co-chairs, Senator Kim, Vice Chair Senator Kidani, my Vice Chair Senator Aquino, and Senator Keoho Kolole. Okay, moving on. Dr. Lewin, State Health Planning and Development Agency in support.
We stand on our testimony in strong support and with agreement with the Department of Health about 21 cents.
Thank you very much. Next, we have Dr. Ueno of University of Hawaii System and support.
Yes, my name is Naoto Ueno. I'm the director of the University of Hawaii Cancer Center. I stand on the written testimony. Hawaii Cancer Research Special Fund has been instrumental in advancing cancer research, clinical care, and community outreach. Thus, we renew the NCI designation with the best score in the history. This fund has helped to advance our cancer care by research. Fiscal responsibility is our priority. Under President Hansel's leadership, we are working on a roadmap to address challenges at the Kaka'ako campus, an effort to improve efficiency and to further impact our patient and community. As the only NCI designated cancer center in the Pacific, we have a responsibility to our community. This investment strengthens our economy, attracts federal grants, and ensures local patients receive world-class care without leaving home. Mahalo for your time and support.
Okay, thank you very much. Next, we have Tom Yamachika, Tax Foundation of Hawaii. I see Jade. Please proceed.
Thank you. Good afternoon. This is Jade McMillan on behalf of the Tax Foundation of Hawaii. We've submitted some comments on the measure. Within our comments, we've noted that the bill contains many blanks, so that was to provide many blanks, which does prohibit proper vetting. Next question we're wondering is what's the purpose of the tobacco tax? If the goal is to make people stop smoking by making it cost prohibitive, then it does seem to be working. As predicted, the programs that have been fed by the earmarks from the tobacco tax have become a victim of the success of tobacco cessation programs and publicity. So the revenues have been in decline, and hosting the age from 20 to 21 didn't really reverse the trend. We feel that fiscal reliance from sin tax is inadvisable, and the tax law is not the best way to affect behavior. Thank you.
Okay, thank you very much. Next, we have Jacob Macumber-Rosen, Tax Foundation, providing comments. Michael Zenner, Hawaii Smokers Alliance, in opposition. Lindsay Stroud, Tobacco Harm Reduction 101, providing comments. Lindsay, are you present on Zoom? Please proceed.
I am. Can you hear me?
Yes.
You see me? Okay, thank you. I do stand by my written comments. I just really wanted to highlight some points. First, this bill's not needed. Smoking rates are at the historic lows. Only 9% of adults were currently smoking in 2023, and only 3% of high schoolers were. I also want to point out that this is very, very regressive. Adults earning $25,000 or less were 3 times more likely to smoke in 2023 than counterparts who were earning $50,000 or more. And that same year, adults who had not completed high school or its equivalent, were 3.8 times more likely to smoke than Hawaiians with a college degree. So all of that's coming from the Centers for Disease Control and Prevention's behavioral risk factor surveillance system. Happy to answer any questions or go over those numbers. And thank you for your time today.
Thank you very much, Lindsay. Next, we have J.C. Mikulinek, Queens Health Systems, in support. The number 1 store, Nam Wong, in opposition. Mr. Wong, are you present on Zoom?
They are on Zoom, Chair.
Mr. Wong, turn on your video and your microphone and please proceed. Okay, while we are waiting for you to turn on your mic and your, oh, there you are. Please proceed.
Hello, Chair and community member. My name is Nam Hang. I have owned a family business in Honolulu for over 20 years. I understand the goal of increasing cigarette tax to fund cancer research, but I worry about the bigger impact. Increasing cigarette tax hit low-income people harder, as they have less disposable income. My customer have a different time as it is. This bill will push people to buy cigarettes from illegal market, which is proven to happen like in California and Boston. The state enforcement of rule and safety is challenged, as it is possible leading to more danger for the public health.
Okay.
Instead of raising
Mr.
tax,
Wong,
we should.
Mr. Wong,
Yeah.
thank you very much. Next up, non-stop convenience, in opposition. Juan He, Mayun He, S&K Wholesale, in opposition. Next up, Michelle Jordan, Discount Smoke Shop, Hawaii. Are you present, Mr. Jordan, Ms. Jordan?
Not present on Zoom, Chair.
Hawaii Public Health Institute, in support, Kevin Ramirez.
Aloha and good afternoon, Chair, Vice Chair, and members of the committee. I'm Kevin Ramirez, the Program Manager for the Coalition for Tobacco-Free Hawaii, which is a program of the Hawaii Public Health Institute, here to testify in support with amendments for HB 441 HD2. We respectfully request the bill be amended to raise the tax by at least $1 per pack to maximize potential public health benefits for youth prevention and adult cessation. A tax increase of $1 per pack would see a 6.9 reduction in smoking for youth under 18 years of age, and approximately 2,000 current adult smokers would quit. A cigarette tax increase is long overdue. It's been 13 years since the cigarette tax was last raised. Increasing cigarette taxes regularly corrects for inflation and consumer purchasing power. Recent polling shows strong voter support. According to an independent poll conducted by Ward Research, 78% of registered Hawaii voters support an increase in cigarette taxes. Thank you for the opportunity to provide testimony in support of HB 441 HD2. We respectfully ask you to pass this measure out of committee with the requested amendments. Mahalo.
Okay, thank you very much. Next, we have Tina Yamaki, Retail Merchants of Hawaii in opposition. Tina Yamaki, are you present on Zoom?
Not present on Zoom, Chair.
Next, we have Cynthia Au. I see Cynthia Au here, American Cancer Society in support.
Thank you, chairs, vice chairs, and joint committee members. My name is Cynthia Au on behalf of the American Cancer Society, or American Cancer Society Cancer Action Network, or ACS-CAN. ACS-CAN supports with amendments. ACS-CAN supports increased funding for UH Cancer Center. 9,000 residents from Hawaii will hear the words, "You have cancer," this year, and more than 2,000 are expected to die from the disease. While projections in 2025 mark an uptick in new diagnoses, there's a decline in deaths compared to 2024 because of institutions like the UH Cancer Center, which provides important cancer research, access to life-saving treatment, including clinical trials, and education, which play a critical role in reducing the cancer burden for our diverse population in Hawaii. Tobacco use is the #1 preventable cause of cancer, and 1,400 adults will die from smoking this year. Respectfully ask that you increase the cigarette tax to 5 cents a stick or $1 per pack. This will reduce future healthcare costs for the state of Hawaii.
Thank you very much, Cynthia. Okay, next up, Grace Sakanishi, Chinatown Liquors in opposition. Grace Sakanishi, are you present on Zoom?
Not present on Zoom, Chair.
Next, we have Evan Oy, American Heart Association in support. Evan. Okay, we're moving on. Young Park, Wawa Village Market in opposition. Young Park, are you present on Zoom?
Yes, I am.
Okay, please proceed.
Good afternoon, members of the committee. Thank you for the opportunity to speak today in opposition to House Bill 441. As a concerned citizen and representative of our community, I am here to voice my opposition to the proposed tax increases outlined in HB 441. Raising taxes will not only be the burden hardworking families, but also have unintended consequences that could harm our community in the long run. First, by increasing taxes, we individually incentivize the growth of illicit market. When legal products become too expensive due to the high taxes, consumers often turn to unregulated sources to meet their needs. This not only diminishes the expected revenue from the tax increase, but also puts consumers at risk by pushing them into unregulated markets where product safety and quality cannot be guaranteed. Second, when the only solution discussed is to raise taxes, it seems the community isn't being heard.
I'm sorry, Miss. I'm sorry, your time is up. Okay, next up, we have Kona Liquor Store in opposition, Brian Yee, Coalition for Tobacco-Free Hawaii Youth Council, Scott Stenswood in support, Dennis Hull, Americans for Tax Reform in opposition. Dennis Hull, are you present on Zoom?
Yes, ma'am. On behalf of ATR, I stand in opposition to HB 441 as not only an infringement on consumer choice, but as a highly regressive tax. Take a look at New York. Low-income people are spending a quarter of their income on cigarettes, but the well-off are spending about 2%. And you'll continue seeing a trend in this direction if this bill is to pass. And it's worth noting that even though a pack of cigarettes is now $20 in New York, a double-digit percentage of the population continue to smoke. So to solve this problem once and for all, I believe it will take more than public information campaigns or even the high taxes you're promoting in this bill today. It'll take ease of access to real effective alternatives that provide nicotine to these people, which is what they really need. And that's what flavored vapor products and nicotine pouches have the near miraculous ability to provide. Please take a look at my written testimony on this bill, where I've included a list of reasons why it's crucial that you support these alternatives. And I hope that you allow your constituents to make this important choice for themselves rather than pressure them, coerce them, and force them. Thank you.
Okay, thank you very much. Next, we have Ra-Long, R&K Liquor and Grocery in opposition. Ra-Long, please come on up.
Hello, Chair, Vice Chair, and members of the committee. My name is Ra-Long. I've been in a business in Chinatown for over 12 years. I'm here to express my opposition to HB 441. If HB 441 passes, it won't stop smoking. It will just drive more people to illegal sources. I understand the concerns around smoking and public health, but I must highlight an unintended consequence of higher taxes, which is the growth of an already driving illegal market here in Hawaii. Right now, our community is already dealing with the influx of illegal Chinese cigarettes being sold on the streets, in game rooms, and through unregulated vendors. These products are smuggled in, untaxed, unregulated, and often sold to anyone without regard to public health or age of consumer. Increasing taxes will increase the illicit market here today that is already a challenge to manage, as we have seen with the lack of illegal firework enforcement. I urge this committee to please oppose this bill. Thank you.
Thank you very much. Next, we have Hawaii Coalition for Immigrant Rights and Support. Liza Gill.
Yeah, sure. Actually, I'm here for tobacco-free kids, but I will stand on our testimony in support with the amendments. We have been looking at this issue and across the board, and I think I would like to echo what Hi-Fi has communicated, that we haven't seen an increase in tobacco tax in 13 years, and obviously we've seen a significant amount of consumer purchase price change and inflation since that time. Mahalo.
Okay, thank you very much. Ray Vara, Hawaii Pacific Health in support. Travis Yoshinaga, American Market in opposition. Jeffrey Kwan, Young's Wine and Spirit in opposition. Gerald Morita, Cigarettes and Things in opposition. Alan Johnson, HSAC Hawaii Substance Abuse Coalition in support. Dr. Ignacio, Hawaii Medical Association in support. Danny Huang, Eva Pantry and Kaka'ako Smokes and Bevmart in opposition. Michael Young, Hawaii Health and Harm Reduction Center in support. Chevelle Davis, Hawaii Children's Action Network Speaks in support. Ian Ross, Y&I, Coast Comprehensive in support. Health Center.
Thank you very much, Chair San Buenaventura, Chair Donna Kim. On behalf of the Waianae Coast Comprehensive Health Center, we are in strong support of this measure. As a health center located in a community with higher rates of tobacco compared to state averages, we're acutely aware of the devastating impacts on the community. Lung cancer, heart disease, other conditions linked to smoking remain leading causes of preventable death in our state. We believe this measure is a step in the right direction, and we urge your support. Thank you very much.
Thank you very much. William Goose, Cigar Association of America in opposition. Luke Itomura in support. Luke, are you present?
Aloha, chairs, vice chairs, and committee members. My name is Luke Itomura, and I'm a sophomore at Punahou School. Thank you for the opportunity to testify in strong support of HB 441 with an amendment to increase the cigarette tax by at least $1 per pack. As a youth advocate, I've spent years working to protect my generation from the dangers of tobacco. Smoking remains the leading cause of preventable death in Hawaii, taking 1,400 lives each year, and yet 95% of adult smokers start before the age of 21. This issue affects my peers who could become addicted before they even understand the risk. Research has consistently shown that smaller tax increases fail to create the significant behavioral changes needed to reduce smoking rates. A $1 increase, however, would have a measurable impact, leading to 2,000 adults who currently smoke quitting, a 6.9% decrease in youth under 18 who smoke, and $31.8 million in long-term healthcare cost savings. This bill is more than just about numbers, it's about protecting future generations from addiction and disease. By raising the cigarette tax by at least $1 per pack, we can prevent young people from ever picking up that first cigarette.
Okay, thank you very much, Brian. Luke. Next is Brian Mee in support. Brian, are you present? Okay, next, Kahu Dennis Barger in support. Jessica Chang in opposition. Larry Lang Wu in support. Sherry Parubro in support. Gail Ichida in support. Becky Ward in support, Karen Kalanta in support, Tripit Revesman in support, Kangas Lee in support, Cam Ning in support, Tina Wildberger in support. And we have a list of another 20 other people in support and one person in opposition. Anybody else wishing to testify on HB 441? Members, any questions? Okay, oh, we also have Senator Hashimoto present. Are we ready for decision making? Okay, you have quorum? Okay, so he's in both of ours. Okay, so for HB 441 HD2, the chairs having conferred, we are going to pass this with amendments. We're going to replace the contents with SB 1528 SD1 with the following exceptions. We are going to accept DOTAX's proposed amendment, and on section 3, line 7, this is what it looks like. All of these then go to the depth. Sorry, all of these go to depth, or just from B, C, and D. That's why I said, so all of this, I mean, basically, we're just gonna say all proceeds go to debt reduction. I'm just gonna take all of this out. Yeah, just say, right, all debt. Okay, and with the other exception being that on section 3, subsection 7, all proceeds from the increased tax shall go towards the Hawaii Cancer Center's debt reduction. And the effective date of December 31, 2050. Any comments, questions, concerns?
Question.
Yes, Senator Kidani.
Before the vote, I would just like to know if there has been any surveys from here or other states as to what happens to the population of the smokers once cigarette taxes are higher. Do they go on to something different, stronger?
Okay.
What's the downside?
Okay, so I believe somebody here.
I think the gentleman on Zoom already mentioned it in New York, where it wasn't really effective to combat smoking at all.
So the opposition is saying that basically it doesn't affect.
Yeah, no, but my question is really, what else do they do if they're not smoking?
Vaping.
So this is not including vaping.
No.
Yeah, just.
Okay.
For
Any
that
other
reason, I'm
comments?
not supporting.
Okay.
Should make an amendment to that.
Well, any other comments, questions, concerns? Okay, seeing none, Vice Chair, for the vote, pass with amendments.
Okay, House Bill 441, House Draft 2, recommendation of the chairs to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keokolole. Aye. Senator Favela.
Aye.
Recommendation is adopted, Chair.
Same recommendation for the Committee on Higher Education. Chair votes. Any discussion, our members? Hearing none, chair votes aye.
Chair votes aye, Vice Chair votes no. Senator Fukunaga. Excused. Senator Hashimoto. Aye. Senator Favela.
Aye.
It is adopted, Madam Chair.
Okay, and with that, the joint session of Health, Human Services, and Higher Education is adjourned. Calling the 110 calendar, Health and Human Services for HB 1334 relating to meat donation. First up, we have Nicholas Vargas for DLNR in support. Are you in support? Or DLNR? No? Okay. Yes. You're going to stand on your written testimony. Thank you very much. Okay, next up, Department of Agriculture in support. Is Department of Agriculture available? No. Councilmember Yuki Lee Sugimura in support. Brian Miyamoto, Hawaii Farm Bureau in support. Jackie Keefe, Maui Adoption Project in support. Lauren Zerval, Hawaii Food Industry Association in support. Lauren Zerbel, are you present on Zoom?
Not present on Zoom, Chair.
Okay, Robin Keene, Maui Wild Game Management to Feed the Hungry in support. Anybody else wishing to testify on HB 1334 relating to meat donation? Okay, seeing none, members, any questions? Seeing none, moving on. HB 1098 relating to crimes against protective services workers. First up, Director Yamane in support. Director.
Support. Thank you.
Thank-
Everything that's about.
Thank you very much. Department of Law Enforcement, Mike Lambert in support. Deputy Prosecuting Attorney's Office in support. Stick around.
Good afternoon.
Go ahead.
Good afternoon, Chair, Vice Chair, and members of the committee. Daniel Hugo for the Honolulu Prosecutor's Office, and we're in strong support of this bill. We will just note, in addition to our written testimony, that there are chilling effects when protective services workers face the threat of assault. And so we do think that a greater deterrent is justified in those cases. I'm available for questions. Thank you.
Okay, thank you very much. Thomas Chang, Honolulu Police Department in support. Officer Chang, are you present on Zoom?
This is Acting Captain Trent, who's present for Captain Cheng.
Okay, please proceed.
Okay, the Honolulu Police Department is in support of this.
Could you turn on your video? Is that possible?
Oh, yes, I think so. Hold on one second. Okay, can you see me now?
Yes.
Okay, so the
have everything.
HPD
That's
supports House Bill number 1098 relating to crimes against protective service workers. This bill appropriately provides an additional mechanism to protect our protective service workers against assaults and threats while performing their official job duties. Protective service workers are public servants who perform vital tasks to ensure our community members are healthy and safe. Signing these measures into law will help better protect our protective service workers from harm and threats. And I'll be available for any questions.
Okay, thank you very much. Next, we have Malena McKee in support. Anybody else wishing to testify on SB 1098?
Officer Wellness and Resilience stands in strong support of this measure.
Thank you. Anybody else wishing to testify on HB 1098? Seeing none, members, any questions?
Yeah, I do. Prosecutor's Office.
Prosecutor's Office.
Mr. Hugo, so I'm looking at the bill, and it says in subsection 1, a person commits the offense of assault in the second degree if A, they intentionally, knowingly, recklessly cause substantial bodily injury to another. And then we have the same standard for correctional workers, in your, you noted in the testimony, teachers, healthcare workers, emergency services providers. What's wrong with subsection A that we gotta have subsections B, C, D all the way down, and we just keep doing this every year?
So Senator, substantial bodily injury has a specific meaning. It's limited to 5 classes of injury, some of which include a major laceration, avulsion, or penetration of the skin. That's one category. Another is a broken bone. There's also second-degree burns. So if an injury falls outside of that classification, it merely qualifies as bodily injury, which is a misdemeanor. So an example that I can give is if an assailant causes massive bruising to the victim, but does not fall into any of those specific classes of substantial bodily injury, that remains a misdemeanor.
Any other questions?
Okay, I guess that makes sense, but I mean, I haven't heard the prosecutor's office ever come in and go, you know what, we should just make assault. We should just strike the substantial bodily injury, because would you guys be opposed to that approach? Because this is, I swear, the 7th year in a row where we've had some special class come in and ask for felony protection, and it just seems like what I'm hearing you say is that the misdemeanor doesn't work.
So what I would also point out is that the state of mind for these status offenses, or where the victim's status is an element of the crime, is also intentionally or knowingly. So we have to prove that they were aware and that the attack therefore was most likely motivated by that person's status as particular workers who do get into volatile situations. Now, if the legislature wanted to consider maybe creating just a broader category of people for this offense or consolidating them, I'm certainly happy to discuss ways, but this is dealing with something that's more like our assault on law enforcement statute, where it's not just the injury, but it's also the status of the worker that is a part of the offense.
Right, like subsection N, which is basically refs.
Right.
It just seems like this section doesn't work, and we're just going to keep doing this every year until we have absolutely every professional category.
Well, you will get no argument from me about the need to take tougher action against criminals, and part of this happens because we see these cases come up and they merely qualify for misdemeanor penalties.
Yeah, I mean, this is more a reactive approach than, maybe it's time for us to take a more proactive approach on this section and the offense, right? Until because otherwise we're just going to keep waiting until some person in some industry gets beat up real bad, and then they get added to the subsection.
Well, we're certainly in favor of a proactive approach, and I'd be happy to talk about ways that could happen. But on the specific merits of this bill, our office does support it.
All right. Well, well then, if that's the case, I appreciate that, and I thank you for that comment. And I would say that if in the future we see another measure like this, I would hope that the prosecutor's office would offer some proactive opinion on this rather than going all the way to subsection Z and then AA and all the way back. Thank you. Thank you, Chair.
Thank you.
Okay, thank you very much. Any other questions? Director Yamane, come on up. Okay, so I saw the Department of Health, Department of Human Services testimony about an incident that occurred on the mainland, and I fully understand the increased stressors on the social workers with a high vacancy rate and the high emotion that is occurring. Sort of in line with Senator Keohokololi's questioning, other than, and I see the need for this, okay? I mean, because we want to say, the legislature wants to put a position that we support our social workers. But is the department doing anything else to increase the safety of these social workers, especially in highly volatile situations where a child may end up having to be removed?
Yes, Chair. So we actually are working right now with the Department of Law Enforcement, not only in placement of panic buttons throughout all of our offices, also looking at apps that social workers and our child welfare as well as adult protective service staff can use, in which they can have it on their phone. The difference regarding the response is many of these we wanted to go to the sheriffs, because state sheriffs monitor state buildings. However, for the sites that we are doing private, we would go through HPD. We're also looking at upgrading our security systems, both cameras, door locks, and we are trying to work that right now, not only with DAGs, but with those that we currently have contracts for our rental space. So we're looking at those. Some of the things we are trying to finalize is additional training for, let's say, active shooter on-site training. And we're doing all these to increase safety and awareness.
Okay, and the monies necessary for those, the apps, the panic button and the like, are those part of the budget?
Currently, we're working with Delhi because they may have some funds. Those funds that are not enough, we are looking internally to cover it. So we did have a request in the budget to cover statewide expansion of all of this. However, we do want to put in some measures immediately. So I am looking at current ways to be creative with our current funds to cover that.
Thank you very much.
Okay, thank you.
Anybody, any other questions?
I have a question for the director.
Okay.
Yes, sir.
This just came to me.
Okay.
Have you considered body cameras for like your CPS workers?
We have not. That's an interesting idea. We'll bring it back. For us, regarding our children and youth, there's some concerns about, having children videotape, but we would look at that. I know in the past when at the ledge, we looked at that, there was an issue about how you house the data collected, right, from the body cams, who has access to it, who can use it, in those circumstances. But right now, I would not turn away any idea to increase safety for our workers.
Right, because I acknowledge, but I mean, a lot of the protections that are required for the dissemination of video that includes minors is already you already got to follow those rules.
Yes.
Right, so then we'd be talking about redacting or blurring faces or whatever if the content were needed to be distributed in some sort of public forum, right?
Right,
So
that's correct.
maybe not. So you're not saying no? Okay, thank you.
Yeah, that's saying no.
Stick around, one more question, follow up. My understanding regarding, especially for removals, a policeman is already involved, correct? So that policeman will have the body camera available.
Typically, we involve law enforcement. So for example, if we do, it comes into our line, we send out a team, crisis response team that we go out and we feel we need law enforcement, we will contact HPD because we do not have the legal authority just to access homes without cause.
Okay, but it's the potential for visitation and other where there's no law enforcement that you may need these other safety measures, correct? Okay, any other questions? Okay, seeing none, moving on. HB 1079, relating to trauma-informed care. First up, Director Yamane in support. Thank you. Next, Hawaii State Council on Mental Health in support. Trina Orimoto, Office of Wellness and Resilience in support.
Good afternoon, Chair, Vice Chair, members of the committee. 3 things in addition to our written testimony. First of all, thank you so much for hearing this bill. Second, it is one of the few remaining bills alive this session that has an action item from the Malama Ohana Working Group, so we do see it as a priority. And lastly, we're humbly requesting for the committee's consideration appropriations for $420,000 for the 2-year program. As many of you have wisely noted in prior committee hearings, we understand the financial uncertainty given all of the federal changes. However, we see this bill with the appropriation ask as an integral part of the transformational change and support that the Malama Ohana Working Group has recommended and asked for. We stand ready for questions and really appreciate, again, you hearing this bill.
Okay, thank you very much. Next, we have Marilyn Yamamoto, Hawaii Coalition for Child Protective Reform and support. Noreen Cole, Hawaii Children's Action Network speaks in support. Nonohe Botello, Hawaii Coalition for Child Protective Reform and support. Judith Clark, Hawaii Youth Services Network in support. Lori Tochiki in support. Anybody else wishing to testify on HB 1079? Members, any questions? Okay, seeing none, can we move on to decision making? Okay, you got all the vote sheets. Okay, so for HB 1334, Chair's recommendation is to pass this only with a different effective date of December 31, 2050. Otherwise, no other amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, voting on House Bill 1334, House Draft 3, recommendation of the chairs to pass as a SD1. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Keokalole. Aye. Senator Favela is excused. Recommendation is adopted, Chair.
So for HB 1098 HD1, Chair's recommendation is to also pass this, but also with a different effective date of December 31, 2050. And I'd like to note to Department of Human Services that the Senate bill version of this died in JDC. So we urge you to be proactive as to the other steps to protect our social workers and getting those funding. Okay, so thank you very much. Any other comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Anyone voting with reservations? Any noes? Recommendation is adopted, Chair.
Thank you. So for HB 1079, Chair's recommendation is to also pass this just with a different effective date of December 31, 2050. We are going to note on the committee report OWR's request of $420,000 for this. And I'd also like to point out to OWR that the Senate bill version of this also died in wham. So we urge you to implement what you need with the funds you already have, and let's see what we can do next year. So just because it passes this committee doesn't mean it's gonna pass, okay? Any other comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
And with that, the 110 calendar is adjourned. Calling the Joint Committee on Health, Human Services, and Economic Development and Tourism. Present with us is our EDT chair, it's Senator DeCoy. First up, we have the only measure, HB 714 relating to healthcare workforce development. First up, we have Director Yamane, who left, in support. Comments? Are you present for DHS on Zoom?
Not present on Zoom, Chair.
Okay, Dainty Bartoldes, Hawaii State Council on Developmental Disabilities and Support. Thank you very much. James Tokioka of DBED and support.
Dennis Lane for DBED. DBED stands in its written testimony and support.
Thank you very much. Jack Lewin, State Health Planning and Development Agency in support.
Chip stands on his testimony and support, Chair. Thank you.
Thank you very much. Laura Nagel, University of Hawaii System and support. Laura Nagel, are you present on Zoom?
Not present on Zoom, Chair.
And I'm with the community colleges, so we do stand in support. Thank you.
Okay. And you are, excuse me?
Della Terra, Vice President.
Community colleges, thank you. Community colleges is in support. Hilton Rachel, I see that you're here. Healthcare Association of Hawaii in support.
Thank you, Chair, Vice Chairs, members of the committee. This measure will provide state funding for 2 years to continue and expand proven healthcare workforce development for high school students and current nurses. We have 4,700 openings for non-physician patient-facing roles within the state of Hawaii, with a growing need for entry-level positions like CNAs. The programs supported by this measure are having a material impact on addressing our workforce pipeline. Last year, we were able to serve more than 100 public high school students across 14 schools, achieving a 98% completion rate and 75% employment rate. We're also able to support 34 CNAs in the Glide Path program, and we have over 50 students enrolled in the program this year. So healthcare employers have heavily invested in these programs, providing instructors, hands-on training, and financial stipends. With your support, we'll be able to continue these programs. We have requested an amendment to remove a reference to capital expenditures because this funding request is for programmatic expenses only. Thank you for your time.
Okay, thank you very much. Next, we have Jonathan Chink, Kaiser Permanente in support. Kaiser, no. JC McCullinet, Queens Health Systems in support. Queens, no. Mike Wen, Aloha Care in support. Mike Wen, are you present on Zoom?
Not present on Zoom, Chair.
Okay, Laura Reichart, Hawaii State Center for Nursing in support. Hawaii State Council on Mental Health in support. McKenna Woodward, Office of Hawaiian Affairs in support. Elena Kabatu, Hilo Benioff Medical Center in support. Eric Abe, Hawaii Primary Care Association in support. Kobe Chalk, Alzheimer's Association of Hawaii in support. Dr. Elizabeth Ignacio, Hawaii Medical Association support. Linda Beechner, Hawaii American Nurses Association in support. Michael Robinson of Hawaii Pacific Health support. Palani Smith, Liberty Dialysis in support. Erin Rogan and Roseanne Nolan of Sherman support. Walden Alf, HMSA in support. and Sharon Schwartz in support, Christine Masaloy in support. Anybody else wishing to testify on HB 714? Members, any questions? Come on.
County Department of Education, standing on our written testimony, but support.
Thank you very much. Anybody else wishing to testify on HB 714? Members, any questions? So I do. Tammy, could you come on up? Sorry. You're the only one from state. How much is this gonna cost? Do you know? Because none of the testimony I got has a cost.
May I refer to Hilton Raytheon on this one?
Hilton Raytheon, how much is this gonna cost?
Just under 1.5 million for 2 years,
Okay,
for each of 2 years. So there's two different programs and approximately 750,000 per program
per
each year.
program.
Yeah.
Okay, thank you very much. Any other questions? Seeing none, members, do you have?
Waiting for one more right now. Anyone?
Yeah, Tim was here. Okay, but HHS can vote. So for HHS, Chair's recommendation is to pass this with amendments. We're gonna note the blank appropriation already on there, as well as just change the effective date to December 31, 2050. We're also gonna pass this with HAH's proposed amendments. And we're gonna note in the committee report, the $750,000 request for each of the 2 fiscal years requested. Any other comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, voting on House Bill 714, House Draft 1, recommendation of the chairs to pass with amendments. Chair and Vice Chair vote aye. Senator Hashimoto. Aye. Senator Kehoe-Kalole. Aye. Senator Favela is excused. Recommendation is adopted, Chair.
Committee on Economic Development and Tourism, same request. Vice Chair for the vote, Chair goes aye.
I vote yes. Senator Fukunaga is excused. Senator Kim.
Aye.
Senator Awad is excused. Chair, your recommendation is adopted.
Thank you.
And with that, we are adjourned. Thank you, folks.